Hi, how are you going? I hope you're feeling as well as possible on your medicines. I'm Pharmacist Fi, and this is Denver. Welcome to our Medicine Safety YouTube channel, and to this episode of What Went Wrong? Mrs. O had been taking 2 blood pressure medicines for about 10 years now, and while the medicines did lower her blood pressure, since Mrs. O had retired and started walking for at least half an hour most mornings with a friend, her blood pressure had gradually come down further. So now, on most days, it was at the target blood pressure goal that she and her doctor had set. Unfortunately though, no health practitioner had ever mentioned to Mrs. O that she would need to keep taking her blood pressure medicines even once her blood pressure had reached the desirable level. So one day, she decided to stop her blood pressure medicines because she incorrectly thought that once her blood pressure had been brought down, it would stay down even if she stopped the medicines. Also, unfortunately, Mrs. O did not ask her doctor or pharmacist for advice about this. Within a few days of stopping her blood pressure medicine, Mrs. O's blood pressure was even higher than it had been 10 years ago when she first started taking blood pressure medication. And having a sudden rise in blood pressure like that is dangerous because it increases our risk of having a stroke or heart attack. Mrs. O started to get the terrible headaches she used to get from high blood pressure years ago, but this time it was even worse. So she called her friend one morning to cancel their walk, and while they were chatting, Mrs. O started getting weakness in one side of her face. So her left eye would not fully open, and the left side of her mouth started to droop downwards, so all of a sudden she could not speak properly. Thankfully, her friend was able to call an ambulance straight away, and the doctors at the nearest hospital emergency department were able to treat Mrs. O quickly for what they diagnosed as a T.I.A, which stands for transient ischemic attack, which is a minor stroke. Thankfully, Mrs. O regained normal movement of the muscles of her face, but her experience was terribly stressful and frightening, and the outcome could have been a lot worse. So, how could Mrs. O have possibly prevented this serious problem from happening? Top tip number 1. If you ever think that you might need a lower medicine dose or to stop a medicine, talk to a doctor as soon as possible and ask them to please help you to weigh up the possible benefits and risks of what would happen if you did have a lower dose or stop the medicine versus the benefits and risks if you keep taking the medicine at the current dose. And then make a decision together with your doctor about how to move forward in managing your medical condition. Top tip number 2. If you and your doctor ever decide to try reducing a medicine dose or stopping a medicine, ask the doctor exactly how to make the changes as safely as possible. Top tip number 3. Do you know the signs of a possible stroke or TIA? I will put a link into the description section below this video for you to a very helpful webpage about what signs to look out for. Please click the subscribe and like buttons below this video if you'd like to see more of these medicine safety videos. And Denver and I look forward to catching up with you again very soon here on this Pharmacist Fi Medicine Safety YouTube channel. Thanks for watching. Bye.